Now I want to look at intoxication, or you could say poisoning. Intoxication or poisoning, So we're going to look at 3 agents that could actually intoxicate you or poison you. We're looking at methanol, we're looking at ethanol, we're looking at ethylene glycol. So the 3 of them will look at how their intoxication or how their poisoning could actually look like. So I think we'll be picking it one by one. That's after the main introduction. Okay, no introduction even, so let's get it. So methanol intoxication, you should know that methanol, the source is mainly those industrial solvents, antifreeze or adulterated alcohols. So how is it broken down? When methanol gets into your body, it's acted upon by alcohol dehydrogenase. So to become formaldehyde, it also become formic acid. So formic acid causes metabolic acidosis and optic nerve toxicity. So there's also CNS depressions, visual disturbances, snowfield vision, also blood vision or blindness. Then there's also severe metabolic acidosis. So treatment, if you want to counter methanol intoxication, you use what is known as the Fomepizole. That's an alcohol dehydrogenase inhibitor. So to stop this enzyme that normally should be breaking down your methanol, you understand? So you don't have methanol breakdown. So to correct acidosis, okay, you can also do hemodialysis, where I'm taking out your blood, putting it in a machine, trying to purify everything. Also you can also use the folinic acid. The ethanol intoxication. Ethanol is another name for alcohol. So ethanol intoxication is just like I'm saying somebody got drunk. What we literally say. So when ethanol gets into your body, it's converted to acetaldehyde, it's converted to acetic acid. So most of the times, if it is too much overload, okay, then the enzymes are not able to work very fast and convert it to acetaldehyde. So that's where you usually have the intoxications coming in. So you have the CNS depression, disinhibition, ataxia, coma, hypoglycemia, chronic use could lead to liver disease, gastritis, neuropathies. So treatment is usually all the supportive care, like make sure the person is breathing, make sure there's adequate circulation, intravenous glucose, thiamine, So ethylene glycol intoxication now, source is all those antifreeze and all those industrial solvents. When ethylene glycol gets into your body, see, this is it. You can pause to observe, right? So it gets converted to glycolic acid, then oxalic acid. So usually precipitates calcium. So when it gets into your body, it affects the kidney so much. So there's CNS depression, there's severe metabolic acidosis, there's renal failure like pains in the flank, blood in urine, crystals in urine, hypocalcemia and tetany. So if you want to reverse ethylene glycol intoxication, you can also use the Fomepizole or even the ethanol itself. Also hemodialysis, if it is too much in the body and you want to filter it out. Then calcium supplementation if the calcium levels are getting so low, okay, and also thiamine and pyridoxine.